the pelvic floor, and by doing that, it alleviates the need for painful and mostly unsuccessful invasive surgery. Welcome to the Institute for Ageless Living. We are excited to introduce to you a revolutionary new non-invasive way of treating both stress incontinence in females and BPH and ED in males. It is called the Zimmer pelvic floor stimulator. This is a treatment where you actually sit down in a chair and there is basically a magnetic pulse that causes your muscles in your pelvic floor to contract. And when it's directed in the proper place, it's like doing, for a woman, it's like doing 10,000 Kegels in a 30-minute period of time. During that time, you strengthen the pelvic floor. You also bring blood supply to the pelvic floor. And in males, that blood supply equates to curing or helping to alleviate benign prostatic hypertrophy and helping with ED, which is caused by, again, lack of circulation in older men. How it works basically is, as I said before, it increases blood supply to areas and to the areas that the bladder, the pelvic floor, and by doing that, it alleviates the need for painful and mostly unsuccessful invasive surgeries. The benefits are for women and men both. Both of these problems, stress incontinence, urinary overflow incontinence, are extremely socially difficult for self-esteem and for confidence. And when those problems are eliminated, the patients become more confident, more able to be mobile in society and regular people. And that's what they want to be. Everybody wants to be regular people. And again, for men, ED, of course, is paramount in maintaining sexual function, and BPH makes it difficult. And one of the biggest benefits of the pelvic floor stimulator for men is trips to the bathroom at night. A male can, with BPH, have up to 5 and 6 times he gets up to go to the bathroom at night because of his the inability to empty his bladder completely. And with this stimulator, that decreases with a strict regimen of using the pelvic floor stimulator. There are lots of different people that can be good candidates for this. Anyone with benign prostatic hypertrophy, anyone with the ED or effects of sexual dysfunction, and women with any kind of incontinence. These people, especially women that have done multiple births, multiple babies, or even one baby that has dripping or urine incontinence after her delivery. There's really no preparation at all. The biggest preparation of this is deciding you're tired of the way things are and you want to change them. That's the biggest decision to make. After that, we can diagnose through a short evaluation what kind of incontinence a woman has, or what kind of symptoms a male is having, and we can focus the treatments at those problems. It's important that you're well hydrated and you're wearing comfortable clothes. We start people out with 2 treatments a week for a period of about a month. And we start out with about 20 to 30 minutes. And most of the time you can expect after a treatment that you may feel a little fatigued because of the muscle contractions. But most people report that they really feel not a lot of difference, and you don't see a difference until some of the results of the strengthening of the pelvic floor take place. What we expect and what we've seen is for men, decrease in trips to the bathroom at night, being able to sleep better, and not being able having to get up and go to the bathroom 3 or 4 times, 5 times at night. And for women, sneezing, coughing, any kind of exacerbation of abdominal pressure causing leaking and urine, decreased embarrassment, and confidence that they can go into social situations without embarrassment. The machine has different modalities it uses. There's actually one modality that just strengthens a healthy woman. It strengthens her pelvis, strengthens. It's like doing Kegel exercises. It keeps everything fit and strong, which increases sexual activity and sexual pleasure. The other things we do for people with really difficult problems, especially women, is we can do what's called a transurethral injection of exosomes. And that's done here in the office. It's relatively painless. It starts by putting a small catheter into the urethra to stabilize the urethra and then injecting all around with exosomes. And that is extremely successful in treating stress incontinence and overflow incontinence. If you want to learn more about this, the Zimmer pelvic floor stimulating therapy, feel free to look on our website or give us a call, and we'll be glad to bring you in for a consultation.